Hi guys, I just want to jump on here really quickly and give you guys update on what's going on and kind of what to expect pre-surgery for your dentures. My lighting's a little bit different in here tonight, guys. I'm sorry. It's like 9:30 at night here and I'm holding my phone. Usually I'm in my bathroom, so I prop my phone up on the mirror, but I'm holding it today, so bear with me. I'll try to make this as short and sweet as possible and get right to the points. I kind of wrote a little pointless to jump to because anybody that follows my videos knows that I like to ramble a lot. So I finally, June 24th, got in for my impressions. Not a super comfortable thing to go through. It's not painful by any means, but it's not comfortable. So obviously, some of you may or may not have already experienced this, but they have this big metal thing that goes into your mouth on the top and bottom, and they fill it up with like this stuff which hardens. I'm trying to think of the type of material it would harden as, almost like a rubber. Yeah, kind of like that. So anyways, it is liquid, and then as time goes on, it dries really quickly into that rubber. So they use that as a mold. They put it in your mouth. If you have really bad gag reflexes, this stuff goes all the way back into your mouth. So they say you can lean your head forward. I don't have a bad gag reflex, so I didn't have to do that, but it's weird. And then when they pull it out, it feels like your teeth are going to come out with the mold, and they're not, but it's especially when you have, like me, when you have holes all through your teeth and brittle teeth, it's just like when they're pulling this thing out of your teeth, it's not comfortable. So anyways, we had that done. And by the way, I am from British Columbia, Canada, so my story might be different than yours or a lot of other people that you may know that have had this done. But in Canada, we have the choice to go to a hospital and be put under, or we can go to your dental clinic and they can actually extract them in there, but you won't be sleeping. I chose the route to be put under. And so I will be going into the hospital. And so I got the impressions done. That was June 24th. And then during this whole COVID thing, like everything has been kind of delayed. But in my town, we only have one doctor who actually has hospital privileges. And the estimated time to get into the hospital is 3 to 6 months. So I had them done in June. I got a letter in the mail. It said 24 weeks or something like that to like 30 something weeks. So I estimated out sometime end of September to sometime end of November is when I was kind of expecting it. And I'm not sure if the reason I got a call 2 weeks ago was because I am like an emergency situation here, or if it's just because I've been waiting so long prior to COVID that I got called. But anyways, they called me 2 weeks ago and they wanted me to get my dentures and my surgery actually done tomorrow. So August 14th. And unfortunately, I called my dentist and my dentures weren't complete. Now, when I had my impressions done, and this is where I got really nervous. I've been really, really nervous since, and I might have mentioned this in my last video, is when I got my impressions, I got to choose my color of teeth. I did not choose my color of teeth. My dentist chose the color of teeth, and I was so upset because he looked at my teeth and then he grabbed the tooth, and it's like just like one little tooth and it's on a stick, and he just holds it up to your mouth and he's like, yeah, that looks about right. And I looked at it, I was like, oh my God, like not nice. Like all these people on the denture group that I follow all have like nice white teeth, and I'm 30. I'm only 30 years old. I don't want yellow. And so I think he could tell by like my facial expression that I wasn't excited. So he's like, well, we could try one shade lighter. So he pulled out the one shade lighter than that and put it up to the tooth. And he's like, yeah, you know what? We can do that. And so I'm I don't like confrontation. I'm really quiet. I'm nervous. He said that if we went any lighter than what he chose, they were going to look fake. And so I'm like, okay, well, you know, he's the dentist and this is his profession. So I just kind of went, okay. I was told the impressions were going to be sent to the lab and they were going to make a mold. And then the mold was going to come back to the dentist. I was going to come in, and that's where they have the chance to make any modifications before it gets put into like the denture. And so now that I get the phone call and it's the 14th and they're like, no, it's not done yet. Like, we still haven't got them back. And I was like, oh my God. So, she ended up calling the hospital and she's like, you know, we can have, first she called the lab and the lab's like, I can have her teeth done by the end of the month. And then the dentist receptionist called the hospital and the hospital's like, I'll hold the 31st for her. So here we are. I'm getting them done in 18 more days. And I had emailed the dentist on Saturday because I'm like, oh my God, we're 3 weeks away. And I haven't like heard back. Like, I'm supposed to go back to the dentist to look to see if there's any modifications or adjustments to be made. And so she called me on Monday and she says, you can come in on Thursday. So I went in today and I was so nervous. So I told my mom, it's like, they picked yellow teeth for me and I don't want yellow teeth. I'm 30 years old and I want to smile in confidence. Like, basically, I was going to go in there and tell him that you based my dentures off of my current teeth, which all are dead. And like, I'm saying, like, I got a bone in there that needs to be shaved. I got all broken teeth. I got out there. This is broken. This just broke. I think after my last video I just made, this one that just had that hole in it has now broken off in half, and I only got part of the back of that tooth. And he's basing my denture off of my current teeth. Like, I don't think so. Like, who does that? So I was really upset. So I told my mom, like, I'm going to go in there today and I'm going to tell him that I don't want that color of teeth. But I was nervous because I'm like, I need this surgery in 18 days. So if the teeth are already in there, then I guess I just have to suck it up and have those teeth. So I go in there today and I did snap a picture, you guys. I'm really excited. So he held them in his hand and I was like, oh my God, they actually don't really look yellow. There is a tiny, like, I mean, they're not Hollywood white. I didn't want Hollywood white. I didn't want to smile and people be like, and I know some of you are like, I want white as white can be. I don't want that. I am 30. I occasionally do smoke. I drink. I don't need to have like the whitest of the white teeth, but I did want something to be flattering. Like, I want to smile and have confidence smiling. So I took a picture and I really, really need to find a different way to make videos because this whole holding phone and whatnot is not, I need something else. So anyways, I took a picture and I'm going to show you guys. I don't know. Ouch. I don't know if you guys can actually see it. So that's him holding the teeth with his hands. So it's not on my face. It's, oh, sorry. Yeah. Move. Aw. So yeah, those are my soon-to-be teeth. So really, I had no choice in the matter after when I got there because, so basically the teeth are in a wax. So that pink that you see in that picture is a wax. Now that is being sent back to the lab and that's going to turn into the hard denture. But that's what they're going to look like. So they have taken the shape of my teeth and they have put that in there. So which I like that I'm not going to have the shape of my teeth aren't going to change, except for if you look here, how they're not straight. They're straight this way, but so now all of those teeth are now going to be straight. And so I'm super excited. I was so nervous going in there. I thought for sure that I was going to just be so upset that they were going to be yellow, and they're really not. I mean, yeah, I'm excited. So anyhow, during the whole quarantine, COVID, coronavirus thing going on here, all the meetings with the anesthesiologist and whatnot, those are all done through the phone. So I had a meeting on the 4th of August with the nurses on the phone, and that was basically getting a history of everything to pass off to like the anesthesiologist and everyone else, and for their background knowledge, and kind of get like a rundown of how things are gonna go. Excuse me. So she has recommended no drinking, no smoking 2 weeks prior to surgery. So that's like coming up on Monday. So I am not going to drink, I'm going to try to not smoke, or as many as I do. And those are just for healing reasons. And then 2 is the more you drink, it thins out your blood, you'll bleed more. So they try to get you to stay off of that 2 weeks prior. Another thing is she asked how much, if I take any medications. I do take a thyroid pill. I do have, I have Graves' disease, which makes me hyperactive. I also have PCOS. So I do take some medications for those. So I told her, and she's like, that's fine. You can continue those medications. I said I take Advil, Motrin, naproxen, Tylenol, basically on a daily occurrence. I take them every single day, and I take them multiple times a day. So she's like, is it the 200 milligram, the 500 milligram? I'm like, oh, if I'm taking 200 milligram, I'm taking like 6 of those. If I'm taking the 500 milligram, I'm taking 2 of those. And she's like, holy crap, like that's not okay. And I'm like, yeah, this is probably why I ended up in the hospital a couple weeks ago with the kidney issues, is from all the medication I take. And so she's like, okay, so starting now, no more Tylenol, like not Tylenol, no more like Motrin, Advil, any of that. Nothing with an anti-inflammatory you can take, because it also thins your blood. So I'm like, well, what am I supposed to do for pain? She's like, well, call your doctor and see if there's something she can give you for pain. So I called my doctor a couple days ago, and she faxed off a prescription. She has put me on Tramacet. It's an opiate. I do not have an addictive personality at all. So she did give me 30 pills of those to get me through. I did take 2 of them the other night. It did not make me feel high. It didn't, it's like maybe, so difference between Tramadol and Tramacet, if I'm not mistaken, don't quote me on this, but I think it's, Tramacet has Tylenol in it, whereas Tramadol doesn't. So I got the Tramacet, so I don't have to take Tylenol or anything anymore. If I got pain, I just take 2 of those. It says 1 to 2 every 4 to 6 hours, I think. So I do have that for pain now, which is good, because, the amount of Tylenol and stuff that I was taking was so bad on my body. So here we are now, only a couple more weeks to go, and my teeth are basically done now. I have had all the conversations on the phone that I need to with the anesthesiologist, the nurses. On the 28th, I have a COVID screen call. I don't know my time yet. The nurse that I talked to, I had mentioned 10:15 for surgery time, and I was like, oh, really? That's my time? And she's like, oh, well, don't quote me on it. call OR booking. So I did as soon as I got the phone. And then she's like, oh, the 31st? We don't even have a time for you. Yeah, I don't know how they know that. So I don't have a time yet. I do know no eating past midnight the night before. And then the following morning, so morning of, you can have water, apple juice, or Gatorade up to 3 hours prior to your surgery, or maybe check-in. Anyways, one of those. I'm going to go into the hospital. I'll get dropped off in the hospital. I will get registered. They're going to take me upstairs. I'm going to get into a gown. They're going to hook me up to an IV. I'll get nice and comfortable. I'll have a talk with the anesthesiologist. This will give me an opportunity to talk to them if I have any questions. I'll get to talk to my dentist if I have any questions with him. I'll get a little rundown of what's going on. I'm sure I'm going to get told the aftercare probably while I'm awake and coherent and not all dozy. And then they will take me downstairs. I was told that surgery will take approximately about an hour. I'll go into recovery. I'll sit there until I wake up. When my blood pressure, they said I'll wake up. Because the surgery is in my mouth, they do have a breathing tube that goes in, but because the surgery is in my mouth, the tube will go through my nose into the back of my mouth. They'll pull that out before I wake up, but I'll have the oxygen in my nose. And what else they say? I'll still have the IV and stuff, and they'll keep that in, and they won't send me home until I'm comfortable. Once my blood pressure and my oxygen and all that is good, it's at a good level, and my pain is okay, they'll bring me back upstairs into one of the rooms, and I'll just sit there for a couple of hours just to be monitored and make sure that I'm okay. They're not quick to throw you out. They want to make sure that your pain's okay and everything's okay. Then they'll call my hubby and he'll come pick me up and bring me home. So that's kind of the rundown of what I'm expecting here. It seems like it's been a really long time, but with only having my impressions August. So a month and a half ago to already getting my surgery, it's pretty fast and it's pretty exciting. I can't wait to be able to smile. But this is probably going to be my last video for my denture update or denture talk until it's actually done, because there's nothing really more that I can update you guys on. But I probably will be doing a video pretty soon here about Saxenda weight loss. Or no Saxenda weight loss. I haven't been taking it, guys. I have not been taking it, but I haven't been gaining, so that's good. So yeah, I'm gonna jump off of here. I'm gonna get into my bed, and but yeah, I just want to let you guys know where I'm at. And the next time, if you're only watching me strictly for the dentures, the next time you guys see me, I'm gonna have pretty white teeth, and they're gonna look so pretty, and I'm gonna feel so confident and gorgeous. So anywho, good night, guys. We'll talk soon. Bye.